So before the pandemic, my husband and I were walking 4 miles a day, 5 times a week. Everything was closed because of the pandemic. We could not even go outside the house. But that's ridiculous. So they opened the parks and let's go back walking.
Let's go back to doing that 4 miles.
4 miles. I couldn't do it. I couldn't do it at all because I started noticing pain, like sharp little pains in both. Yes. And I go, oh my goodness, I'd never had problems before.
And at the time you were, say, 65-ish?
I'm 69 now.
69 now.
So
before 5 years ago, yeah.
Okay, so then I'm having all these little pains, but in addition to that, I'm having breathing problems, like I'm out of breath, right? So I go through an extensive evaluation, medical evaluation, with cardiology, pulmonary, asthma, everything. No asthma, no issues with my lungs, no issues with my heart. The cardiologist says, it's inactivity all these months. Right. You need to get back to
just some general deconditioning.
But
get back out there and
get back. So we started walking. But I noticed that the pain in the knee kept going. And it was getting worse. And so I would have to sit at a bench for like about 5-8 minutes to relieve the pain and get the courage to continue walking.
Right.
So I went to the doctor and they did x-rays, MRIs on both knees, and they told me that I had torn meniscus on both knees and also osteoarthritis. Right. It was painful. I tell you, it was painful. And they were telling me that it was kind of like bone on bone,
right?
Like especially this knee. Yes. Okay, so one day I was there at home watching television, and then they were showing Arthritis Relief Center.
Yes.
Right? And so I knew I already had osteoarthritis.
That resonated with you.
Right? And so then I said, how about making an appointment? Right down, right? And I called, set up an appointment, and we started with the gel injections.
So you probably had a gel injection a week for a few weeks.
Yes, it was a series.
Yes.
I was having, appointments. After 6 months, I noticed the pain in this leg was completely gone.
Oh.
Completely gone.
Awesome.
But the pain in this leg, on the right leg, persisted.
Yes.
Okay? So, because they were following me, I was telling them about it. Sure. So we did a second series of the gel injections. And it worked for a while. And the pain came back. I think it was about 6 or 7 months.
Right.
Comes back. I speak to Meredith, who's the one that's been helping me. She recommended Genicular Artery Embolization.
Yes.
That's
normal. We call it the fancy knee treatment.
Okay, well, yes. All right. So to discover, they explain, right, that sometimes the artery feeds too much blood into that causing inflammation.
That's correct.
And this procedure that would block some of the flow.
It will block some of the blood flow to the synovial membrane, which reduces inflammation, which takes care of your pain.
And so I came here, I think it was a Saturday that they did this procedure in the morning, and they discovered there were 2 arteries feeding the knee. Right. So they blocked both. And then they told me that a couple of days later, you can go walk.
Yes.
Take it easy.
Sure.
So it was like about 3 days after the procedure. I went back to the trail slowly. I had difficulty with my balance. Of course, they just treated the knee, right?
Sure.
So I walked with a walking stick to help myself with the balance. I was able to do 1 lap, which is half a mile.
This was 2024.
I think,
and it's 2026 now.
Yes.
So this is 2 years ago.
Yes.
Yeah.
And so that was the beginning. And little by little, they told me increase the amount of laps, right? And I told them, when I increase my speed, I feel the pain. And then they told me, when you feel the pain,
back off a little bit.
Back up. But keep walking.
Yes.
So now I'm walking 3.5 miles. Since February, I've been walking 3.5 miles, 5 days a week.
Very
impressive.
impressive.
But of course, I do want to go back to my pre-pandemic level of walking, which is 4 miles.
4 miles. So you got a half mile to go. Hey, not bad for 69.
Hey.
With bone-on-bone knees, right?
So I'm very happy about that.
Do you think if the way you're feeling now, you would rush out and get a joint replacement?
No, absolutely not. Because look, I'm able to stand.
Yes.
You know, we go to the Orthodox church, and there's a lot of standing there.
Okay.
So at first, when I was going through this, I really couldn't stand not even 5 minutes because
goodness.
it was painful.
Right.
I'm able to stand.
Yes.
I'm able to walk. I'm able to do
3.5
anything.
miles a day.
Anything that has to do with this, I'm able to do.
Sure. Yeah, most of our patients would be thrilled just to be able to walk through HEB without having to sit down for 3 or 4 minutes. But you're an overachiever. You're walking 3.5 miles a day.
The other thing that I was remembering was that, form, when you come in, things that I noticed in there that I had forgotten was that I used to have pain at night.
Yes.
And that's gone.
Yes.
That's
a big deal.
I don't have pain at night. Even tell you, that is terrific.
Yeah.
And I am so glad that I call you guys.
Yeah. Oh, we're so glad. I mean, it's just exciting for us to see the improvement, see you get back to the things that you want to be doing, and see you enjoying your life at 69, and not being worried about a major surgery looming in the distant future. So for us at ARVC, we provide a lot of different treatments for knee arthritis specifically, and the gel shots are kind of our staple procedure. If you have knee arthritis, it's an extremely safe, can be a very long-term beneficial treatment for a patient, as long as they keep up with it. Generally, it's every 6 months, maybe once a year for some patients, maybe if they're younger. It's kind of like changing the oil in your car. If you kind of forget about it, then over time, it's going to create more damage. And then, it's going to be harder to reverse that damage the longer you let it go. So as long as patients are routinely getting the shots, they can go for you. I've seen patients on the gel shots for 30 years with no knee replacement. Yeah, and they're doing fantastic. So for other patients that reach a point to where, the gel shots just aren't helping anymore, that's when we do the fancy treatment. And we call that genicular artery embolization. So what the purpose of that treatment is when the knee starts to break down and you develop arthritis, our body actually creates extra blood vessels. And the purpose of that is to try to heal the tissue. Well, what we do is we go in and block those tiny little blood vessels that are abnormal to a normal joint. So we block those. That stops the inflammatory process in the arthritic joint, and it also kills all those little tiny nerve endings that cause the increased pain. And so both of those things together, by reducing inflammation and killing the nerves, now we're feeling a whole lot better with the knee pain. So now we've got like an intermediary treatment for a patient who, doesn't do well with the shots or reaches a point to where maybe the shots don't work. 5 years ago, before we started doing the GAE procedure, it was straight to knee replacement. And for patients that are doing well and we can manage their pain long term, they don't need a knee replacement.
Yeah.
You only need a knee replacement if you're really struggling and it's really inhibiting your quality of life. A lot of patients say, I was already told I was bone on bone and my orthopedic surgeon said I need a knee replacement. Well, that's true if nothing helps. If your pain is not improved with any conservative treatments and you're that severe, of course, maybe it is time for a knee replacement. So another 6 months and we'll see you back for a follow-up, I guess?
No. We're going to play it by ear.
Oh, good. Yes. Okay, perfect.
Yeah, because,
You're just going to keep walking.
Yeah, I'm going to keep walking because my goal is still to pre-pandemic level, 4 miles a day. That's and so I think that if I'm able to accomplish that,
Yeah. Hey,
that's pretty good.
Great. Well, I think if you're doing 3.5 miles already, seems like you can go another half mile.
Yes, I know.
Yeah.